So I use the term freaking out about a lot. So I label it as FOA. And now I've got freaking out about. Why do I use that terminology? Because, well, wait a minute. Of these four, do you think that with prioritization or Ask Graph, and I'm going to go through Ask Graph real quick before I get into this question. It's the one I'm literally scared of. Yeah, Nurse Christie said it. Look, we've got ASKGRAPH. Okay. Back in the day, it was what? Choose one of the 8. But then I came up with the mnemonic Ask Graph. Above all else is airway. Why is this so important? Why so? And I know there's many of you that know this, but it never hurts to rehear this. So we're worried about airway, airway, airway above all else. What are we taught? Normally, we're taught what? A, B, C. That's great in real life. When you're on the boards, yeah, sure. When in the hospital, A, B, C, cool. But the boards get a little bit more specific. So we look at airway, airway, airway above all else. So somebody tell me some terms that we use when it comes to, please don't jump ahead. I know you all know the answer, but please don't jump ahead. What are some words that we use? How about drooling, stridor? Good. Wheezing, maybe, accessory muscles. Silent chest, like that, tripod position, nasal flaring. Good. These are all words that the boards use as clues. Next gen or new gen, next gen or old gen, it doesn't make a difference. The words are still going to indicate that the airway is compromised. So now we look at airway. The S stands for what? Sepsis. But what do I say about sepsis? It's a triad, right? It's a triad. So what are the 3 things we look at? Temp, above or below what? Above 100.4 or below 96.8. Low blood pressure, good, and increased heart rate. Wait a minute. Patient comes in and maybe you're working ER, maybe you're in the ICU, wherever you're at, and you're like, whoa, this patient may be septic. Maybe they're post-op. Remember that? Ash, and we'll get into that. What if they're septic? Which antibiotic am I going to, or what am I going to do? Give antibiotics first? Antivirals first? Combination? No. Fluids. Get their hemodynamics in order before you do anything else. Then we've got K. What does K stand for? Potassium. So with potassium, what portion of the heart does potassium predominantly control? Good. The ventricles. So which means that if potassium is off, what am I at risk for? Ventricular fibrillation, which is what? The most deadliest dysrhythmia that we can find. Have you posted the 9 EKGs that everyone should know? Have you posted that yet on? So it's, if you go to our, there you go on Instagram, I talk about the 9 different EKGs that you need to know. Guess what one of them is? VFib. There you go. VFib. So subscribe to YouTube and Instagram, and you will see these little things that I'm teaching you. They're all there. So with potassium, we're looking at a small and a narrow window, 3.5 to 5. So we've got to make sure that we've got potassium under control, because when I talk about the 9 different rhythms you need to know, and I posted on Instagram and YouTube, subscribe to our TikTok, subscribe to our Facebook. This is where you're going to get all this free information. And you're going to be like, whoa, this is exactly what I saw on my boards. Right? And it's free. It's free. The G stands for what? Glucose less than 70. Are they going to tell me, well, what if this patient has a glucose level of 70? Are we freaking out about that? No, 70 is normal. What if they say 69, but it's so close, Dr. Z, it's so close to 70. It's like right there. Are we freaking out about it? Yes. Ask graph. The R is a little tricky. I had to kind of incorporate this, but we made it work. Good. It's lethargy or grunting. How do you describe it, a pediatric patient? How do you describe a pediatric patient? Lethargy or grunting, right? Typically, not all the time, less than 5 years old. Good. The A stands for, what does AMS stand for? What does that mean? Altered mental status. Good. What are some terms that can let me know that a person has altered mental status? Sudden acute, time frame is a big one. And then how about things like seizures, hallucinations, confusion, delirium? But what about, wait, hold on. I've got an 84-year-old patient that left the stove on and forgot about it. Is that altered mental status? It's not. No, that's dementia. That's dementia, right? For potassium, we're freaking out about both, low or high. Any change. Thank you, Nurse Megan, for answering that. So altered mental status, we're looking at things that are like psychosis and hallucinations and, audio and visual and tactile. Yeah, we got a lot of things that can happen, right? That will say, well, wait a minute, this person, something happened. What's happening, right? Then we've got P. What does P stand for? Peritonitis. So peritonitis, what is a peritoneum? Let's start with that. It encases the GI and our reproductive tract, right? Portions of them. When something goes wrong in the reproductive or the GI tract, whether it be infection or hemorrhage or whatever it is, it's going to affect the peritoneum, the encasement, and it's going to get inflamed. And now we've got peritonitis. How do we know? How do we know that they are having peritonitis or something is wrong? What are some rebound tenderness? Good. So we've got rebound tenderness. We've got rigidity. We've got guarding. Sorry, I'm running out of space here. These are all words, key words, and I cannot emphasize this enough. People that take, and if those of you that follow our Instagram and Facebook and TikTok and all of our social media, when we repost people's testimonies that they've written, not just the ones that come on here and speak, they literally say, ask graph Ask, graph, and the method, right? Those are probably like the two things that they talk about the most. But the reason why Ask Graph is so big is of every one of these, I've given you keywords to look out for on the boards. If you don't know those keywords and you can't identify them, then work on that. They're all available, whether it be podcast or whatever it is, whatever platform, all free, all free. Work, like, watch them and listen to them. And the last one is hemorrhage. If a person is hemorrhaging, well, we need to get them blood. Is that the first thing we're gonna do? What do we give them? IV fluids first, because they're gonna have low blood pressure and have a high heart rate. But wait a minute, Dr. Z, didn't you just say that sepsis, you have a low blood pressure and a high heart rate? I do. What's the difference? Temperature. Good. Good. That is Ask Graph. That is Ask Graph. Now let's work on the method and applying Ask Graph. So what is a method? The purpose of the method, and you've heard this from testimonials earlier today, the method is, we're gonna do practice questions. That's the best part about this, is we're gonna do practice questions for the remainder of the time. The method is a way to organize your thought process. So we're talking about Ask Graph, and I'll talk about Ask as it comes in. But we read the last part first. But in this situation, do we have a last part first? No, it's just one question. So, well, when we see the words first, initial, priority, urgent, most concerning, immediate, report to HCP, that means that we're looking for Ask Graph. After the nurse receives the change of shift report, which client should you see first? I identified that this is one of the 5 types of questions, correct? And this is a prioritization question. This is one that we are freaking out about, which is what we're going to be seeing, because all we're doing is Ask Graph today. But when I look at the question, and I had to learn this myself, I started with number 4, just for organizational process. I did not make a decision, but I compared it to number 3. That's it. Why is that so important? Think about this. If I can just choose between 2 of which one I want to see first, I can eliminate one. Okay. So I took away what was 4 questions and I eliminated 1. I went from 25%, 25%, and I eliminated 1. Now I'm down to 33, 33, 33. You see, so now a client with left pleural effusion and absent breath sounds in the left face, or a client with heart failure who is short of breath, coughing up pink frothy sputum. I said to find me what? Ask Graph. So if I've got left pleural effusion and I've got fluid in that pleural space, it's expected. Good. Excellent word. Versus somebody who's got a heart failure who is, look at the word, who is short of breath. We're worried about what? When I talk about heart failure. Oh, thank you. Somebody said it. What type of heart failure am I concerned about? There's 2, left-sided or left-sided or complete. Good. So we can have both, right? We can have both sides failing, but ultimately the lungs are compromised. So which one of ask graph does 3 become? Airway. This is expected. So I would eliminate 4. I would stick with 3. All right, now we compare 3 to 2. Client with diabetes and stasis, leg ulcer dressing saturated with serosingous drainage. If somebody has diabetes and they develop this drainage and a leg ulcer, wait, could that be one of ask graph? It could be, yeah, it could lead to sepsis, right? But what do I say is above all else? Airway, airway, airway. So could this lead to sepsis? I would say yeah. Could it lead to it? Are they septic? No. Could it lead to it? Yeah. So you see how we have got to look at what's happening. Did we assume that they're septic? We don't assume, right? Take what's in front of you and take that with a grain of salt and be like, look, this is what's going on. Look at what I circled. This is why when people ask me questions, they're like, wow, this person is short of breath. This person with diabetes and stasis, leg ulcer, dressing. You see the difference of the way to analyze these questions? Because whether it be old gen or next gen, when you look at questions, you've got to look at it and be like, whoa, all right, they're giving me clues, words. One word changes everything. How about if I change this to was? If they were short of breath back when they first came in, then okay, well, they were. But this person is, right? All right, so we got rid of number 2. We compare, now we're down to 50-50. So that's why I said get rid of it. Now we're down, you get rid of 1, now we're down to 33%. Now we got rid of 2, now we're down to 50-50. How are we feeling? If we're down to 50-50, we're sitting pretty, right? Now we've got a client with asthma who has shortness of breath and high-pitched expiratory wheezing. Whoa. Okay, now we got 2 different people with airway. But we've got a person with asthma, right? They've got high-pitched expiratory wheezing, cool. Who do we have more time with? Somebody that's literally drowning in their lungs? Or somebody that can maybe just give an albuterol inhaler to? You see the difference? Very tricky. Like, this is the type of stuff you're going to see on your boards. But explain to me, if you have asthma, when you're doing prioritization and you're looking for ask graph, well, these are both airway. Who do I have more time? Who do I have more time with? Somebody that I can give albuterol, or I can go and get a solution of albuterol. Maybe I'll put some ipratropium in there and I give them a nebulizer. I got more time with them. Right? Just like the ulcer, I got more time with them. But with heart failure, who's coughing up and drowning in their lungs, I'm more concerned about number 3. Now, I don't know if this is going to be correct or not, but that's my mentality. That's how I teach. That's the way I think.